Thanks, Julie, for a great presentation. Just as a side note, I actually print that Speak Up workbook all the time for my patients and give them to their family members to go home and look at, and it's a really great document. It's a bit thick, but if you have time to look at it, this is a conversation that's over time. It's not a one-time shot, right? So you just plant the seed and have that conversation all through with patients. It's really helpful. So next I have Anne Jannsen coming to present on a caregiver training. Anne is sitting with three Anns I see at our table, a caregiver advocate in the community, and is a representative on the Lived Experience Advisory Network of our Lanark, Leeds, and Grenville, Ontario Health team. Say that 10 times fast. Yes, Sarah.
Quick comment.
Yep.
Changes to each one, so if you're clicking on Ontario, that's better for your patients or better for families and whatnot, because it's different, so we'll use each province.
So Sarah, just wanted to remind you that Speak Up Ontario is a federal website. But there's each province has its own individual book because there's different legislation for different provinces. So there's an Ontario one that you can print off. All right, well, leave it to Anne.
Thanks, Brianne. I don't know how you're doing this actually. Hello, everybody. It's actually great to be here and in person with so many people in one time. I'm super excited, even though you all look very strange with your masks on. It's great to be here. As Lee said, I'm a caregiver, so I'm going to present on caregiving and caregivers as essential healthcare partners. And then I'm going to introduce a practical caregiver training program that I believe is a tool in our hospice palliative care toolkit. And Anne, another caregiver, will come up and join me, and then we'll take questions together. So a definition of caregivers. There are many different definitions. I'm using the one here now that's pulled together by the Ontario Caregiver Organization. And that organization was established in 2018, and it's a nonprofit that's funded by the government of Ontario. And the fact that it even exists and has become a substantial organization over the last 3 years is a recognition of the important role of caregivers in our healthcare system. So their definition reads, a family member, friend, or neighbor who provides care for someone without pay due to frailty, palliative care, long-term illness, long-term recovery from accident or surgery, degenerative disease, physical or mental disability, or age-related disorder. What's important here is that we are informal caregivers, family members, and it's without pay. And many of you here are in the healthcare profession, so a lot of this will be similar to you, but not exactly the same. So who are we and what do we do? There are 3.3 million caregivers in Ontario. That number is more or less the same. This was still from 2019, but it's pretty much the same, except that there's a new cohort of caregivers that have arisen, of course, due to the pandemic. Of those 3.3 million, it's 50-50 more or less. That's usually not what people expect. When you ask someone who they think is a caregiver, they think it's usually women, and it's pretty close. It's men and women. In the last survey that was done, this is still the same, and there's a 1% that did not identify as male or female. What do we do? Well, a big percentage of what we do is emotional support, but it's everything of living and dying at home, taking each other to medical appointments, doing indoor domestic tasks, making meals, coordinating the care amongst the different healthcare providers, managing finances. The list goes on. I think what's important is the huge emotional support that's provided by caregivers. So caregivers are essential. In Canada, family caregivers provide roughly 75% of all patient care. To me, that's a huge and staggering number or statistic that I think we have to keep in mind in all that we do here. Caregivers are essential care partners, and that's becoming a more and more official term for what we are called, and members of the healthcare team. And during the pandemic, particularly, this has become more and more important as caregivers were locked out and people were left to be on their own without their essential care partners. There are more and more institutions like the Sioux Area Hospital that are signing partners in care pledges, and where caregivers are becoming, essential caregivers are becoming recognized as one of the healthcare partners and are allowed access into the hospitals and long-term care facilities. And it's actually amazing. I don't know what the stat is, but every week there's a new institution that is taking this pledge. So again, caregivers in the pandemic, all of you know this, caregivers are on the front line, and all of you are on the front line as well as the family caregivers. 59% say that it has become more difficult since the COVID-19 outbreak. That's a report that was released last Thursday, the latest report by the Ontario Caregiver Organization. And 58% of caregivers that responded to the survey say they are burnt out. So it's not new that caregivers suffer from stress and say that their role is highly stressful. This, the larger graphic is from 2019, and already there were upwards from 50% that said their job was either highly stressful or somewhat stressful. So it's not new. But I also point out that in the smaller graphic here, that all of those who say that their job is stressful, almost all of them also say that it's highly rewarding or somewhat to highly rewarding. And that's the part that keeps us going. So caregivers and hospice palliative care. Caregivers enable their family members, partners, friends, and neighbors to remain in the home, which is where most people want to be. In palliative care, the patient and their family are the unit of care, and the well-being of both is equally valued. So that's actually really important as well, and not somewhat unique to palliative care, but something that hopefully is embedded throughout the healthcare system. And here, just family is defined by the patient. It doesn't necessarily mean a blood relative. It's whoever their circle of care is, that's determined by them. So again, caregivers in the pandemic have their role and importance has become underlined even more, as has hospice and community-based palliative care. Another recent report that was released by Health Canada and Healthcare Excellence, just in June this last year, they have a number of interesting conclusions and recommendations. These are a few that are relevant to what we're talking about, but that home and community-based palliative care has proven to be of paramount importance in caring for people during this crisis. And I'd say, I'd end it in caring for people, not just during this crisis. And the need for psychosocial, physical, and practical supports for caregivers is a priority and requires focused and sustained attention. And there was ... long beyond the pandemic. Some more here is that the importance of timely access to palliative care education and training has become abundantly clear. And the importance of hospice care in some ways was recognized recently by the government of Ontario when they provided extra funding to hospices, particularly in support of high quality palliative care for individuals and families. It wasn't a huge amount, it was still in the millions, and we need in billions, but it's nice to see. So we have a mandate here that the Ontario Palliative Care Network has a vision to see a hospice palliative care system that puts patients and families at the center of every decision. It's a system of care that's available to all Ontarians who need it, regardless of their age or illness. And then more locally here, the Southeast Regional Palliative Care Network, who is part of the Palliative Care Committee and funding this, and who Julie is also representing, and supporters of the training program. Our goal is every person with a life-limiting illness will receive timely, high-quality, seamless palliative care that respects their choices. And in their work plan, they have enhanced patient and caregiver engagement in hospice palliative care. So there's a lot that we know, and I'm making assumptions here, but I think that I can do that. It's a risk, but I know that we all know this. We have a mandate. We know that we can only meet this mandate with caregivers as healthcare partners. We know that the majority of Canadians want to age in place and that they want to die at home. That sometimes that's 70%, depending on the research that you look at, it could be up to 90%. And yet still the majority will die in hospital. We know that we have serious gaps in access to hospice palliative care, particularly in our region, and a shortage of nurses, PSWs, physicians, and NPs, especially those with experience in palliative care. But this is exciting because in this room is a source of palliative care that is very exciting for me to see. But it's a small group still. But if it wasn't for a number of you in here, I think I would have personally been through a lot harder decisions with the people I've cared for. Anyhow, so the other thing that we've already said is that we know that caregivers provide 75% of all care. To repeat that again. So how do we support, enable, and empower this incredible member in our community to help us reach our goals? And this is where the practical caregiver training comes in. The training is inspired by Janet, who was a health policy consultant in the Champlain, the Ottawa area. And she was diagnosed with cancer and wanted to prepare her husband, who was going to be her primary caregiver. And she didn't find the resources that she needed to do so. So she approached the Champlain Hospice Palliative Care Program, which is a robust and well-funded program, who then in turn developed this program that puts the needs, values, and wishes of the patient in the forefront. They used a palliative philosophy and approach to care, in which psychological, social, emotional, spiritual, and practical support for both the loved one and the family caregiver is at its core. So this is what makes this training unique, is that it is all from a palliative care approach. It's designed specifically for unpaid caregivers of a friend or loved one living with a life-limiting illness. It's peer-led, it's facilitated and presented by a group of caregivers. One of the nurses sitting at the back, Martha Slavin, and a physiotherapist also who works locally, Andrea Pickett. And it's hands-on, it's a small group, and it's 4 weeks of support where we actually really troubleshoot together and answer questions together. And it's freely offered, and it always will be. That's part of the prerequisite in offering the training. And the caregiver training that's funded now is funded by Julie's Southeast Regional Palliative Care Network. Yeah, I think maybe I'll go back for just a second and just emphasize why it's how different it is. There are a lot of different webinars and resources available for caregivers now. A lot of them are online, so they're not personalized, they're not relevant locally. You know, we can't, some of them are for urban centers. So what's available to us rurally or for our rural situation is not the same as to those urban caregivers. So what's unique is that we don't offer you solutions that you can't access and then send you off and to despair. Yeah, and I think also that it's just that we keep it small enough so that everybody's learning from each other and sharing their stories. Hands-on and practical, we look at all elements of this trajectory of the life-limiting illness, medication management, and they are mind-boggling to us as caregivers, and the patients sometimes can't even begin to understand them. Advanced care planning that Julie has just referred to. Communication can be really difficult, both with our loved ones as they go through this whole process, and also with healthcare providers. People are afraid. We're afraid of doctors. I'm not, well, actually I am too. Navigating the system. Just how do we navigate this complicated system of care, especially in our region where we have the Ottawa Hospital and the Kingston Hospital, and our Ontario Health team is split up in this large geographical area. End of life, we don't shy away. We talk about it. We answer questions. Dignity, how do we maintain dignity when we're looking after our loved ones and providing personal care? And how do we provide personal care and avoid our loved ones from getting bed sores? Body mechanics, the lifts and transfers. So again, it's very hands-on. We're lucky enough to be at the Algonquin College where they have a PSW lab, so we can use all their mannequins and each other. And then of course, self-care and self-compassion. I used to shy away from those words, but they are essential. And and they are woven throughout the entire program. Without that, the rest of everything else will fall apart. So the training, it's also proven. We are really rigorous in evaluating and getting, doing surveys and getting feedback from the caregivers after every class, but also pre and post the 4 weeks. And I don't expect you to be able to read this, but this just is to show you the steep learning curve and feeling of confidence that caregivers experience pre and post the class. Some of the questions are that were asked. I know how to prevent my loved one from developing bed sores. I know what to expect at the end of my loved one's life. I know how to advocate on behalf of my loved one. So it's a steep, learning curve. Okay, and now you're up, Anne. So this is all the qualitative data, and I thought it'd be great to hear from Anne, who participated in the training, in our first training program, and she's one of the 3.3 million caregivers. And this is another Anne, and this is Anne with her partner, Louise.
Hello. Thank you, Anne, for that, and thank you for inviting me to talk to you folks today.
And you just have to be close to the mic. So
Okay.
Thank you.
I was referred to this course in early 2020 by a friend. And at that point, I was feeling pretty isolated. Sorry, did you breathe on it?
I did.
I was feeling pretty isolated. COVID didn't help, as most of you know. I was overwhelmed, and I was actually feeling a little resentful, which was not a nice feeling. So I was sent off to this course by my friend. And the first thing I learned when I walked into that room was, I'm not alone here. And being with those other people and sharing our stories just lifted a huge weight off of my shoulders. I can't really express it. It was so helpful. And I found it was pretty easy to slide into that attitude of, I'm the only one that knows how to take care of her. She's the only one that knows how to take care of me. And we kind of went down that road together. And that just wasn't going to work. So during the program, I discovered all the many and varied supports that were available in the community itself and how to access them, and that you can access them at any time. And it was like, oh, okay, we can maybe do this then. I also learned how important it was to be proactive and to ask for help before you got yourself into a crisis. So while I was there, I also learned several hands-on practical things that I wasn't familiar with, lifts and transfers and that sort of thing, medication management. I thought I had a pretty good system, but turns out there are better ones. And I learned about the many aids that have been made available to be used in the community for safety at home. Bed rails, walkers, things like that. And I found out where to find them and who to ask about their use. That was also very practical. In this program, there's also a recognition and an empowerment, and you're recognized as being an essential caregiver. And the empowerment that you're given allows you to ask questions and to receive answers from your medical team and from your home care network. Usually you would just sit around and wait for the dear doctor to tell you what you're supposed to do, but you can ask, it's out there. Communication, I learned that communication was key, both with your loved one and with your medical team. It's important to respect the dignity of your loved one. And it's oops, who moved that? It's also very, very important to offer them some autonomy during the course of this. The reference that was made by Julie, I believe, regarding powers of attorney and the legal documentation that's involved, I can't stress enough how important that is, and to do it now before you have a crisis. So at the very end of it, of the course, which seems kind of odd when you think about it, we were going to have a class on self-care for the caregivers. And we got shut down in that March of 2020, and it was done on Zoom. And I was really sorry to miss that in person because it was excellent offering. But what I did learn from self-care is that it is an essential part of your caregiving. Without that, the caregiving will fall apart. And I thought, when I first talked about it with people, I thought, I have laundry to do, I have to go to the pharmacy, that's not going to happen. But because of the stress given to us in our positions, and it was stressed throughout the program of how essential this was. Fortunately, my partner and I were able at this point to still have these discussions, and together we planned it. We planned that part of the day was to be for me, and it became part of our schedule during the day. Was just the same as meals or medications. There was time out for me. So every day I had time out in a good way. So the three big areas that I appreciated so much in this program were that I was not alone, and that there is help, and that it starts here.
Thank you, Anne. And I just wanted to share that Louise has died, and that what was the date? June 13th. And Anne was a fantastic caregiver. Oh, Anne just said that the picture was taken at Marywood. That is very interesting. Uncanny. Okay, so clearly, at least to me, and I hope to you also now, the practical caregiver training really does bolster caregivers' ability to cope. It builds caregiver confidence, and it builds the capacity in the community at a grassroots level to actually meet our goals that Leigh Wahay has, that she spoke about in the opening remarks, and that Julie has mentioned in the advanced care planning as well, and also Brianne in the goals of that program. So I find that it's a subtle but very powerful tool in our hospice palliative care toolbox to ensure that everyone receives timely access quality palliative care. I put a little star there because I just wanted to say, I don't feel that the burden of providing hospice palliative care should fall on the shoulders of informal family caregivers, but I think that while we're building up our system and we keep improving on it, that caregivers can be an incredible asset and need to be supported. So questions, do you want to come back up, Anne, as well, in case there's questions for you? And so the next caregiver training is in March, coming up, and hope that you can share this with your clients and your family and friends. And there's little flyers out there. There's just enough for here, and I hope they're all gone by the time we leave. And also, if anybody's interested in sponsoring the next training, we have funding for March, and then we'll be looking again. So thank you. And if there are any questions.
Yes, question here. Yes, that you
I can't hear you, I'm sorry.
Does your loved one need to be in a palliative situation
They need to be diagnosed with a life-limiting illness.
So a life,
Yeah, you do.
So a life-limiting illness is not always a cancer diagnosis, right? And so when you think of palliative, you have to, right? So you could have end-stage heart failure or an end-stage cardiac or end-stage whatever, because it's a life-limiting illness, right? So the way I always think about it is there's not a cure. You can't, quote, fix what's going on. So just remember that there's a different, the two are categorized different, but are the same. So it's an excellent question.
Yeah, maybe I can add to that, that about 50% of the caregivers are looking after loved ones with illnesses such as ALS, Parkinson's, cancer, and that the other 50% are looking after elderly people with either frailty or just elderly parents. So it's, I know that's not a life-limiting illness, and technically we all are living with a life-limiting illness, aren't we?
yeah, I just wanted to say that my husband has ALS, and I was really feeling just over the top. I couldn't handle it, and my friend Anne recommended this course to me, and it was just amazing. And Anne was amazing, and the other people on the team, and it was just so empowering and supportive for me. It made a huge difference. So.
Thank you, Anne. Do you want to say that to the group, or we're okay with the people who can't hear that, right? This is a caregiver, Anne, who recently took the program, whose partner has ALS, and who really feels that she's benefited from the program. Thanks, Anne.
Oh, there's a question online. Hold on.
Can anyone attend the palliative?
So can anyone attend your caregiver course in March?
Can anyone attend the caregiver course in March? Yes, definitely. So on this little flyer, there's the details on how to contact us, and I will send it out through Chelsea as well. Yeah, yes. No, it's free, and it will always be free. Yeah. Yeah, Julie.
Yeah.
I don't really have a question. I just want to say that the slide with the graphics where everything went up was a truly amazing thing to see. For every question, it's obvious that the caregivers have felt empowered in their confidence, in their knowledge, in their skill set. That's in such a short turnaround. That is a real accomplishment in the program. Thank you so much.
Yeah, so what Julie said was that it was amazing to see the level of confidence go up from pre and post class. And it is a great program. I mean, I didn't develop it. The Champlain Hospice Palliative Care Program developed it. And I saw it as a caregiver and knew it needed to be presented here. And I've myself benefited from it greatly. We do adapt it, of course, to make sure that it's locally relevant and also relevant to the presenters so that we can really speak with passion and from our own experience. But thanks, Julie.
So a question from the virtual about equipment, like if you have any pearls on where to get
Equipment, we do. Maybe I'll send that out. There, you know, the Civitan clubs provide equipment that you can loan. I wonder if that person could send it to me and I can send them details about it. But we do. We have lots of. That's the kind of question that comes up in the course. It depends on where they're located as well, where I would suggest they go.
She's located in Brockville.
In Brockville, okay. That I don't know the top of my head because I do Smith Falls, Perth area, but
Okay.
but they don't do Brockville. Yeah. There was some, yeah.
So this course is offered in Ottawa, Algonquin?
No, it's offered at the Perth. Sorry, did I? Yeah.
No, I didn't.
And the Perth campus, and they're not sponsoring us, but they're allowing us to use their lab for free. And so it's a great partnership. They did last year as well, and they're doing so again this year. Yeah. No, it's really specifically for people with a loved one right now, unpaid caregivers. Yeah. So, you know, it's a good question because hospice volunteers, for example, will, you know, apply or want to be part of it, but it's very specific. And we want to keep that group of people who are experiencing similar things small and tight. Yeah.
What does the schedule look like? Over 4 weeks that
It's over 4 weeks. It's on, it'll be Tuesdays from 9 to 12:30. We tend to end early. We have refreshments for half an hour in between. And then there'll be, yeah, we're always done earlier, but 9 to 12:30, 4 weeks. And then in between, we'll send out and answer questions, and we have backup materials, but there's no homework, although there sort of is, isn't there, Anne? Yeah, there's actually a lot of homework. Oh, you know what's interesting is what Julie said about the advanced care planning. Often people will start the course without having any, advanced care planning, or having not had difficult decisions with their loved ones yet, and they'll end the training having done that, or at least having a really clear understanding of what their loved one wants. Yeah. Yes.
To the other end, I was really interested in your concept of building time into building time into your daily schedule for yourself. Now, the answer to this may change with your partner's condition, but did that typically mean you would bring someone else into your home to be with them, or could you start off initially by just still being around, or maybe being out, but your partner is well enough that you would go out for a couple of hours?
That's true. Having out-of-home care come in was a terrific bonus, and that allowed me to go do grocery shopping or whatever. But before Louise got up in the morning, I had about an hour or an hour and a half. I would get up earlier on purpose just so I could do my yoga. And I had an hour in the afternoon when I would go for a walk. And we talked about it together. We planned it together. So there was no guilt involved.
Anyone else?
Yep. Will you be able to access this workshop in March over Zoom? I am a full-time caregiver for my husband with Parkinson's and stroke.
Such a good question. No. I mean, maybe we will provide another course over Zoom. This one is in person, and we are only doing one at a time. Oh, I didn't repeat the question.
That's okay, because I spoke right into the computer, so anyone attending virtually would have heard me clear as day.
Okay, thank you. But if people are interested, I would really recommend that they send me an email so that I can show the interest there, and then I can lobby Julie to be able to present the program again. Yeah, because it does need to be presented more than once a year, and we had to already postpone this one from November to next March. Yeah. Yeah.
Is there anything available for, my mom, for example, was a caregiver for my dad who had dementia. She couldn't leave from 9 to 12:30.
Yes.
Just like that, so.
Well, and that actually reminds me of Rebecca and the great role that Rebecca plays. Rebecca's in the back there from Community Home Support, Lanark County. And when we first did the training, there was an offer that through your program, Rebecca, they would be able to provide respite for caregivers to be able to attend. And we haven't formalized that, but maybe that's another thing that we can look into again. Yeah, so I encourage you that don't stay away because you don't have the time. This is why you need to come, because you don't have the time. Yeah, and we'll do our best to try and allow you to have respite, or, troubleshoot how you might be able to do it. Yeah.
Just a question from Jill. She was wondering, is there support to help caregivers attend these events, which I think you just answered.
Yeah, support in terms of respite. Yeah. Yes, that's an interesting one, because we're looking at actually having the program just focused on specific illnesses or diseases, because it is so different. Some of them are different. A lot is exactly the same, or a shared experience, but dementia is one that is quite particular. So yes, we'd still encourage you to apply, but we're also looking at doing something separate for dementia, and they have done that in the Champlain. They start running them separately. Yeah, Tara, sorry, I should be asking you to speak to this. So Tara is actually, no, but I should introduce you there, that Tara is from the Champlain Hospice Palliative Care Program. Yeah.
You've done a beautiful job presenting the program. And yeah, I just wanted to make that known, is that the program Brittany developed, I call Brittany, is no longer with her program, she's gone, but she worked with the Dementia Society to develop, particular modules or particular aspects of the original models to be, to work very well with their experience.
Yeah. So, but just for the people who are on Zoom, that Brittany, who's the coordinator of the program, who we worked with very closely, she has developed modules that are specific for dementia. Yeah. And the Dementia Society here, or the Alzheimer's Society here, is a phenomenal resource. If anybody has not yet accessed that, amazing. Okay, yep.
Great, no, okay, so.
Leigh, I want to say, just, this is totally me. I just see Dr. Kniff here, and I see you, Dr. Leigh, and I see Sarah Kearney-Nolette, and all three of you were phenomenal in my very acute caregiving experience, and I'm very grateful to see you here like this, and thank you still.